So, good afternoon, everybody. Moi, avec le docteur Njoo et le Major-General qui sont à Ottawa aujourd'hui. There have been more recorded cases of COVID-19 in Canada in the last few days. There have been record number of cases in the last few days. And this is obviously concerning to everyone. For our part, the federal government has been working closely with our provincial colleagues since the beginning of the pandemic to ensure that Canadians are supported. As you know, this week, Prime Minister Trudeau will host a First Ministers meeting with premiers to continue these urgent discussions surrounding our collective response to COVID-19. It will be our 23rd meeting with premiers since March, and this is a meeting that we are very much looking forward to. Nous pourrons discuter des questions urgentes liées à la pandémie, notamment en mettant l'accent sur les vaccins et sur l'importante discussion concernant les moyens de renforcer notre système de soins de santé. Dès le premier jour, le gouvernement fédéral s'est engagé à concentrer sur les besoins des Canadiens pendant la pandémie. Les Canadiens s'y attendent et ils ont absolument raison. Our government has provided, as the finance minister and the prime minister have said, 8 out of every $10 spent by all governments in the fight against COVID-19, investing $322 billion to support Canadians since the beginning of the pandemic. From protective equipment to rapid tests, we have sent the provinces. Our government has been there every step of the way. Canadians want us to remain focused on seeing them through this pandemic, and that is exactly what we are focused on. Thank you very much. Merci beaucoup. I would now like to invite Dr. Tam and then Dr. Words. Yes.
Good day, everyone. Bonjour à toutes et à tous. There have been 423,054 cases of COVID-19 in Canada, including 12,777 deaths. Nationally, there are over 71,540 active cases across the country. And over the past week, labs across Canada have tested an average of over 80,000 people daily, with 8% testing positive. Yesterday, 6,499 cases were reported nationally. In addition, there were over 1,370 new cases reported for Saturday and Sunday. So this brings the average daily case count to over 6,415 cases for the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average over 2,680 individuals with COVID-19 being treated in Canadian hospitals, including about 530 in critical care, and an average of over 92 deaths were reported each day. Yesterday, the Government of Canada announced some good news about vaccines amid our ongoing concerns about rapid growth and increasing severe outcomes of COVID-19 in Canada. Pending regulatory approval, assuring quality, safety, and effectiveness, Pfizer is set to provide us with up to 249,000 early doses of a COVID-19 vaccine in December. But it is important to stress that, as welcome as this news is, it does not mean that control of COVID-19 will be quick. Initial supplies of COVID-19 vaccines will be limited, but supply will gradually increase until there is enough to provide access for all Canadians. During these initial stages of vaccine rollout, it is crucial that we all continue with public health measures to protect ourselves and others. The response to the COVID-19 pandemic is the biggest collective effort of our lifetimes. It has relied on the effort of all Canadians, from individuals, institutions, all levels of government, and across sectors. As we embark on Canada's COVID-19 vaccine response, I am confident that together we will be successful in rolling out one of the most complex operations ever to take place in public health. Canada has an existing strong foundation for pandemic response, including vaccine regulation, distribution, and delivery. In addition, our partnership with Major-General Fortin and the Canadian Armed Forces has added significant expertise and experience to manage the complex operational and logistical arrangements. Knowing safe and effective vaccines are within sight might lead some to think COVID-19 is no longer a problem, but the reality is very different. Canada and many countries around the world are still experiencing high infection rates, which has placed intense strain on hospitals and health systems, as well as the health workers that have been responding to this crisis for many months. So we need to keep telling ourselves, this is not a race to the finish, but a test of our continued collective effort and resolve. And we will endure. For now, we must all continue to follow local public health advice and maintain individual protective practices that will keep us safe along the path ahead. Merci. Thank you.
Bonjour à toutes et à tous. Il y a eu 423 054 cas de COVID-19 au Canada, dont 12 777 décès. À l'échelle nationale, il y a plus de 71 540 cas actifs. Au cours de la dernière semaine, des laboratoires de toutes les régions du pays ont analysé les tests de dépistage de plus de 80 000 personnes par jour, dont 8 ont reçu un résultat positif. Hier, 6 499 cas ont été signalés au pays. En outre, plus de 1 370 nouveaux cas ont été signalés pour les journées de samedi et de dimanche. Cela porte à plus de 6 415 le nombre moyen de cas signalés quotidiennement au cours de la semaine dernière. Le nombre de personnes gravement malades continue d'augmenter. Au cours des 7 derniers jours, plus de 2 680 personnes atteintes de la COVID-19 en moyenne ont été traitées dans les hôpitaux canadiens, dont environ 530 se trouvaient aux soins intensifs. En outre, plus de 92 décès en moyenne ont été signalés chaque jour. Hier, le gouvernement du Canada a annoncé de bonnes nouvelles au sujet des vaccins, malgré l'inquiétude qui persiste au sujet de la croissance rapide et de l'augmentation du nombre de cas graves de COVID-19 au Canada. L'entreprise Pfizer est prête à nous fournir en décembre jusqu'à 249 000 doses initiales d'un vaccin contre la COVID-19 sous réserve de son approbation réglementaire qui en garantira la qualité, l'innocuité et l'efficacité. Cependant, il est important de souligner que, même si cette information est encourageante, cela ne signifie pas que la pandémie de COVID-19 sera maîtrisée rapidement. La quantité de vaccins contre la COVID-19 sera d'abord limitée, mais elle augmentera graduellement jusqu'à qu'il y en ait suffisamment pour que tous les Canadiens y aient accès. Pendant les premières étapes de la distribution des vaccins, il sera indispensable de continuer d'appliquer les mesures de santé publique pour nous protéger et pour protéger les autres. L'intervention à la pandémie de COVID-19 représente la plus grande action collective de notre vie. Elle repose sur les efforts de l'ensemble des Canadiens, à savoir des individus, des institutions, de tous les ordres de gouvernement et de tous les secteurs. Alors que la campagne de vaccination contre la COVID-19 s'amorce au Canada, je suis convaincu qu'ensemble, nous réussirons à mener à bonne fin l'une des opérations de santé publique les plus complexes jamais mises sur pied. Le Canada dispose déjà de solides bases pour la lutte contre les pandémies, notamment pour la réglementation, la distribution et la livraison de vaccins. De plus, notre partenariat avec le Major-Général Fortin et les Forces armées canadiennes nous permet de tirer profit d'un savoir-faire et d'une expérience considérable pour gérer les aspects opérationnels et logistiques complexes. Savoir qu'il y aura bientôt des vaccins sûrs et efficaces pour amener certaines personnes à penser que la COVID-19 ne pose plus de problème. Mais la réalité est toute autre. Le Canada et de nombreux pays enregistrent toujours des taux élevés d'infection, ce qui met à rude épreuve les hôpitaux et les systèmes de santé, ainsi que les travailleurs de la santé qui interviennent dans cette crise depuis de nombreux mois. Nous devons donc nous dire qu'il ne s'agit pas d'une course, mais plutôt d'une épreuve d'endurance exigeant de la solidarité et de la détermination et que nous nous en sortirons. Pour le moment, il faut tous continuer de suivre le conseil des autorités sanitaires locales et d'appliquer les mesures de protection individuelle qui nous garderont en sécurité. Merci.
Thank you. Merci, Dr. Njoo. Thank you, Dr. Tam. So obviously now we're open to questions, and Major-General Fortin will be prepared to answer any questions around the logistics involving the vaccine rollout.
Merci beaucoup. Donc, nous allons commencer avec les questions au téléphone pour 3 questions. Chaque personne a le droit à une question et une question de suivi. We will start on the phones for questions, for 3 questions, 1 question and 1 follow-up. Opérateur, c'est à vous.
Our first question, la première question, Raymond Filion, TVA. Your line is open. À vous la parole.
Merci. Une question pour le ministre Dominic LeBlanc. Monsieur LeBlanc, j'aimerais vous entendre au sujet de la rencontre de jeudi avec les premiers ministres. Vous en avez parlé dans votre déclaration. Les provinces réclament, comme vous le savez, 28 milliards de plus par année. À quel point c'est réaliste comme demande, selon vous?
Bien, comme vous savez, depuis plusieurs mois, le premier ministre Trudeau a accepté la demande des premiers ministres des provinces et des territoires d'avoir une discussion sur la question des soins de santé et comment garantir des soins de santé accessibles et de qualité à long terme. On a vu évidemment la demande fournie par les premiers ministres pour cette augmentation-là. Nous sommes évidemment heureux d'avoir la conversation, de débuter la conversation avec les premiers ministres ce jeudi, après-demain. Mais nous allons aussi constater l'énorme investissement du gouvernement fédéral dans les mesures de santé publique, dans les mesures d'appui aux Canadiens, aux entreprises canadiennes depuis le début de la pandémie. Si la pandémie a nécessité des investissements fédéraux qui dépassent le 300 milliards de dollars depuis le début de la pandémie, et nous allons continuer d'appuyer les Canadiens et les provinces et territoires dans leurs besoins importants de soins de santé dans le contexte de la COVID-19. Alors, nous allons aussi discuter cet enjeu-là. Évidemment, nous allons discuter avec les premiers ministres des provinces et territoires l'importance de coordonner nos efforts en termes de déploiement du vaccin qui s'en vient.
Mais on sent que vous souhaitez mettre davantage d'emphase sur la pandémie, sur l'urgence sanitaire actuelle jeudi, plus que sur les demandes des provinces à plus long terme pour le financement de la santé. Est-ce que c'est une observation qui est juste?
Moi, je pense que les Canadiens s'attendent que leur gouvernement, les gouvernements provinciaux et le gouvernement fédéral, s'attachent aux questions importantes liées à la pandémie et à la COVID-19. Moi, ce sera surprenant que les premiers ministres des provinces et les provinces du Canada se rencontrent pour discuter des soins de santé, puis on ne constate pas l'urgence de continuer notre collaboration en ce qui a trait à la lutte contre le COVID-19, de discuter l'arrivée prochainement des vaccins et de constater que le gouvernement fédéral a investi 8 $ sur chaque 10 $ qui a été dépensé par les gouvernements pour appuyer les Canadiens dans le contexte de la pandémie. Et nous avons transféré au-delà de 20 milliards de dollars aux provinces et aux territoires déjà pour leur aider avec, par exemple, l'équipement de protection personnelle, le traçage et les contacts, les appareils de dépistage. Alors, nous allons continuer d'appuyer les provinces et les territoires d'une façon très importante, mais nous avons tout à fait hâte à une conversation sur comment on peut travailler ensemble pour s'assurer les soins de santé de qualité et accessibles à tous à long terme. C'est un objectif que nous partageons parfaitement avec les premiers ministres des provinces.
Prochaine question.
Merci. Thank you. Our next question, la prochaine question, Steve Scherer, Reuters. Votre ligne est ouverte. Please go ahead.
Hello. I think this question's for Dr. Tam. Yesterday, officials in Ontario said long-term care residents may need to wait for the Moderna vaccine because of advice from Pfizer to avoid moving it from its initial delivery point, something that Pfizer confirmed to us. Will this delay vaccination for long-term care residents across the country, and was this unexpected?
So I think it's a rapidly evolving situation. So I think everyone has to remain flexible and adaptable. And I think some of this will come through the dry runs and all these preparations that we will have initially. That is the concept at the beginning of rolling out the Pfizer vaccine, is to try and sort of keep it at the point of use. That's for a start. I expect that as more information, as more experience with the vaccine and its transportation from the initial site of where you deliver the vaccine, that will change. So I do think that's a fluid situation. But it's true that you cannot move residents very easily from a long-term care facility to a vaccination site. So that's just the realities. In the meantime, you got to continue to protect long-term care facilities, as I said, using all the public health measures necessary, and including testing and screening and personal protective equipment to protect our elders.
Okay, thank you. The next question is for the Minister, LeBlanc. U.S. President Trump is expected to sign an executive order today to ensure Americans have priority access to COVID-19 vaccines. And I wanted to ask if you think this will affect the delivery of the up to 249,000 Pfizer doses expected next week here in Canada. And does Canada have any recourse if this executive order does in fact make it difficult to bring vaccines to Canada from the United States?
So we're very confident that Pfizer and other vaccine makers that are contractually obligated to deliver doses to Canada will be able to meet those obligations. We've said from the beginning, we have a very diversified portfolio, one of the best in the world in terms of different doses, different companies, obviously all subject to the appropriate regulatory approval by Health Canada. But with respect to the Pfizer doses that we expect to start arriving in the coming days, in the next week or so, we have already assumed that we shouldn't be tied to one particular manufacturing site. So the contracts themselves contemplate that Pfizer, for example, has manufacturing facilities in Europe as well as the United States. So we're confident that there won't be any disruption in the effective and timely supply of vaccines to Canadians. We contemplated that in the procurement agreements we've signed.
Merci. Prochaine question.
Thank you. Merci. Our next question, la prochaine question, Catherine Lévesque, La Presse canadienne. Your line is open. Please go ahead.
Oui, bonjour à tous. Ma première question est pour le Major-Général Fortin. Je sais que vous en avez un peu parlé hier, mais pouvez-vous nous expliquer avec le plus de précision possible comment va se faire la distribution des vaccins qui va arriver dans les prochains jours, c'est-à-dire où est-ce que ces doses-là vont arriver, comment elles vont être distribuées aux provinces et jusqu'à l'administration des petits vaccins. Merci.
Oui, alors, comme j'expliquais hier, 14 sites initiaux des points d'usage, des points d'utilisation ou de distribution ont été identifiés par les provinces pour le vaccin de Pfizer. Alors, ces endroits-là ont été sélectionnés par les provinces. Ils rencontrent des critères qu'on peut s'attendre de voir en termes de milieu hospitalier, le personnel médical approprié en quantité suffisante et les compétences requises pour procéder avec la gamme des tâches à exécuter à partir du moment où on reçoit le produit à destination dans une boîte congelée à température ultra basse, la manipulation des produits jusqu'à l'administration du vaccin. Les provinces ont sélectionné des sites additionnels. Au cours des prochains jours et semaines, on va commencer à activer ces sites-là au niveau des provinces Et puis ils ont été sélectionnés particulièrement pour tenant compte des conditions indiquées par Pfizer pour pouvoir administrer le vaccin d'une façon efficace, rapide à tous les Canadiens le plus tôt possible. The whole thing? Okay. So this week we start small. Dry run, and then next week the expectation is that we start receiving, or at least we're postured to receive vaccines in 14 initial locations selected by the provinces. And they were selected based on the fact that they require the right personnel with the right qualification in sufficient numbers and the right facilities in hospitals and similar type of facility. Additional sites will be turned on over the next days and weeks by the provinces. They selected those sites, and they will activate those at a pace that is appropriate for the quantities that we expect to receive. And then we'll be able to, with the provinces in the lead, administer the vaccine at scale as they become available. And they were particularly chosen so that they can be close to the population that will receive the vaccines, and the appropriate measures for the handling of the vaccine are being considered. So this is very much with a view to having vaccine accessible to as many Canadians as possible, as rapidly as possible, and as safely as possible.
Oui, donc en suivi, j'aimerais juste, si je peux juste me permettre de préciser, Pfizer donc va les distribuer dans les prochains jours, là, moyennant une approbation de Santé Canada. Où exactement? Est-ce que les doses vont par exemple arriver à Ottawa et par la suite elles vont être distribuées par vos équipes par avion? Est-ce que ça va être par train? Je ne sais pas si vous pouvez être plus précis peut-être sur les étapes là, avant d'arriver à ces 14 sites sélectionnés par les provinces.
Oui, tout à fait. Alors, la compagnie Pfizer est chargée d'amener le produit, leur vaccin, leur candidat vaccin, jusqu'à ces différents points. Les 14, mais aussi les sites suivants qui seront identifiés. Alors, c'est vraiment la responsabilité de la compagnie de faire ça. Une partie des choses qu'on fait cette semaine, c'est de s'assurer que le processus de commande, de livraison, de transfert dans la chaîne froide, toutes ces procédures-là sont bien exécutées. On a visibilité tout au long. Alors, c'est la compagnie Pfizer avec le fournisseur de services que la compagnie a choisi pour faire de cette distribution-là le plus rapidement possible.
Merci. Nous allons maintenant passer dans la salle pour 3 questions et reviendrons au téléphone par la suite. We will now come to the room for 3 questions. We'll come back to the phone after that. Honda, off to you.
Honda McCharles, Toronto Star. Since we're on the dry run and stuff, Major-General Fortin, can you talk about the dry run so far? I gather it goes all week, but so you started it yesterday. What did it look like? What holes did you find? What challenges do you see you have to address in the next while?
Thank you. So it's too early to tell what we learned from that. But one thing for sure is that we initiated the process last week. Really, yesterday, the orders were received at Pfizer, and Pfizer, sent shipping or thermal shippers. So those boxes that were put on the plane yesterday. Yesterday at about this time, they were in the air, and they were flying from Belgium and through different nodes, transfer points. They will make it to Canada in the next day or day after. Upon arrival at the points of use, the data reader will will be able to get the reading from the data reader, so we'll have a good sense of the temperature throughout the journey, and we'll have identified if any critical or failure or friction points in the critical path. Today, people are being trained on this, and then upon receipt, they will handle the package, and they will have learned as a result and share those lessons across the population or the public health enterprise. There are no vaccines. There are empty boxes, but they have dry ice, and they have to be handled with the appropriate care.
Thanks. And if you could also address, there is some questions still around, you mentioned the other day that the Indigenous leaders up north have said to you they want to wait till the Moderna comes along or another vaccine where they don't have such stringent freezer requirements. But could you address more specifically right now where planning is at for the federal government to distribute to the populations it's responsible for, including Indigenous and First Nations, including military personnel and their families and veterans, and including prisoners?
I can cover some of that. So in close cooperation with the provinces and territories, we're identifying those points of use, those points of distribution for the other vaccines. And I realize how complicated this can be using different language, but there's a difference in how the Pfizer vaccine and other vaccines are handled, and the Pfizer vaccine has particular requirements with the ultra-low temperature chain. But the territories have indicated a preference for the Moderna and other products as they are easier to handle because of the particular requirements, as I said, of the Pfizer vaccine. So we're in daily discussions with territories and provinces and agencies and other departments to pinpoint the process, the locations, and ensure that everyone's or every stakeholder's perspectives are accounted for in the plan. And this week, as we continue to rehearse, we identify those additional points of discussion, and we ensure that we have clarity amongst all stakeholders as to the way forward. So we'll continue to adjust as we move forward, but the provinces and territories, that is, really are pulling in a sense of indicating what the locations are going to be, and they will put in the orders as appropriate. But the federal, not for the prisoners and military personnel. Yeah, thank you. So for the other populations, the CAF, the Canadian Armed Forces members, Corrections Canada, this is very much a part of those discussions as well. And where exactly they sit in the priority, I'd have to come back to you. But they will get a small amount of vaccines in the first quarter to address those populations at risk as per the guidance received and being applied across Canada.
Maybe I'll just add that the vast majority of vaccine will be deployed and implemented by the provinces and territories. Very small numbers are expected to address those very specific federal populations that don't get it from the provincial territorial system, that being healthcare workers, for example, in corrections and the CAF, Canadian Armed Forces, or some elderly populations within that context. So they will follow the sort of prioritization approach as well.
Merci. La prochaine question.
Bonjour, Juliane Lapointe de Radio-Canada. Sur l'exercice de simulation, Major-Général Fortin, vous avez déjà répondu un peu en anglais, mais peut-être nous résumer comment ça se passe. Je comprends qu'il est trop tôt pour déjà tirer des conclusions de tout ça, mais dans l'optique où on attend sous peu les 249 000 doses, est-ce qu'on aura le temps de se repratiquer d'ici à l'arrivée de ces doses-là? Et sinon, comment on peut rectifier le tir si on identifie certains défis?
Alors, la clé cette semaine, c'est de passer les bonnes leçons, les observations qu'on va avoir apprises. Les provinces sont tous en mesure de voir ça d'eux-mêmes avec leurs points, alors qu'ils reçoivent la boîte et puis procèdent à travers toutes ces étapes-là. Le personnel est en train d'être qualifié aujourd'hui sur les particularités de la manipulation du produit de Pfizer. Alors, ces leçons-là seront partagées. Et à partir de cette base-là, tout le monde va évoluer vers l'état de préparation, un état de préparation approprié pour les autres sites qui sont identifiés. Les congélateurs sont mis en place, le matériel Le matériel requis pour les vaccinations est en train d'être distribué par les provinces et aussi le matériel fédéral qui est mis à la disposition des provinces pour les renflouer. Alors, tout ça, c'est en train de se faire présentement. Alors, on est en très bonne posture pour commencer la semaine prochaine et ensuite d'augmenter le nombre et la capacité de ces sites.
Monsieur Dr. Njoo, peut-être seulement ajouter un autre point que si on parle de la vaccination des populations prioritaires avec l'équipe, c'est vraiment une équipe intégrée. Il y a deux aspects, l'aspect de santé publique, aussi l'aspect logistique, opérationnel, et on travaille vraiment en étroite collaboration parce qu'on ne peut pas avoir une côté sans l'autre. Merci.
Puis, concernant, donc, on s'entend que les premières personnes qui vont recevoir, justement, les personnes qui ont été ciblées pour recevoir les premiers vaccins, on parle de personnes âgées, des personnes dans les foyers de soins surtout. Est-ce que vous êtes satisfait qu'il y a suffisamment de tests qui ont été menés par Pfizer auprès des personnes âgées? Est-ce qu'on ne joue pas avec la vie de ces personnes-là, finalement, qui seront les premières vaccinées?
Peut-être que c'est une question pour moi. Non, c'est pourquoi on attend encore toujours la décision de nos collègues réglementaires de Santé Canada, parce que c'est eux qui sont en train d'analyser les données probantes, les données des essais cliniques, parce qu'il y a toute une gamme de personnes qui ont fait partie des essais cliniques, les personnes de toute une gamme d'âge, aussi incluant les personnes plus âgées. Donc, je pense qu'on fait une compte avec l'approbation. On peut dire aux Canadiens d'être confiants que les vaccins homologués, Pfizer, mais aussi les autres après, sont sûrs et efficaces.
Go ahead.
With CBC. I just want to clarify with the minister. Are we getting all our Pfizer vaccines from Europe? I'm just trying to find out if there's any effort by the U.S. administration to block exports, if there's any chance that our supply could be interrupted.
So, as I said, I'm very confident that the procurement contracts contemplated a diversity of supply. We have no reason to think whatsoever that access to the Pfizer vaccine will be in any way disturbed. And as I said, deliberately in the contracts themselves, we contemplated having access to production facilities on more than one continent. So we're very confident that the commitments that Pfizer made can and will be respected. And that's important for the entire duration of the exercise. As Dr. Njoo, I think, just said, there's the initial doses that will be arriving, we hope, in the coming days after Health Canada's approval. But this process will continue and ramp up in 2021 in a very significant way. So we're also confident that the contractual obligations with Pfizer, but other suppliers also, will be respected. We're not concerned.
In terms of monitoring people who get the vaccine, making sure that they get the second dose, is it the province is going to be primarily responsible for that? Is there any federal role? And is there any federal role as well for monitoring any adverse reactions or side effects to the vaccine?
Yeah, so there's, again, a role for each level of government, I would say. So for vaccine coverage, the provinces or the local administrators of the vaccine have to actually record, of course, who got vaccinated and provide them with their own way of recalling them, if you like, for the second dose. And so that is up to that level of support. We also know that provinces and territories, almost all, have their own immunization registries and their system of recording. But really, the discussion is that they will be sending us information regularly on the actual coverage, for example. But the specific one, first dose, second dose, that's very much on the ground implementation and responsibility. Vaccine safety is a really important aspect of monitoring. As you can imagine, the clinical trials are actually really quite big compared to other vaccine clinical trials with 30, 40,000 people in each. during which we will see from the regulatory authorities what kind of side effects might be experienced. We haven't heard of any serious side effects so far, which is great. But when you actually begin to roll it up into millions of people, even rare side effects need to be detected. For that, we have a foundation of several layers of surveillance and monitoring. Health Canada, as the regulator, has the Canada Vigilance System requiring reporting. They are going to have requirements of the actual manufacturers to provide more information after approvals. The public health system can report in, and with the Public Health Agency of Canada, called the Canadian Adverse Effects Following Immunization Surveillance System. That's just routinely, it's already happening on an ongoing basis. Then we have networks of additional systems looking at, from hospitals, for example, detecting more serious adverse events. On top of that, there are research networks that will be ready and clinical networks that will be consulted if someone has an adverse effect following an immunization, as well as more in-depth studies if adverse effects should occur. So it's really it's a robust layering of many different sources of information. Of course, if we detected a signal, there'll be a rapid response to investigate a signal that's detected. So then on the aspect of actual coverage, other than provinces reporting to us on the numbers that's been delivered, we are already planning actual surveys with, in collaboration with Statistics Canada. Now, those go into more depth. They can answer different questions in terms of who got vaccinated, their experience, their knowledge, and there's, you can dive in to look at further unpacking the people and their experience who got the actual coverage. So there's going to be quite a few different streams that will be at play. We are also looking at augmenting the information technology platforms as well as needed to support this sort of network of different systems at play.
I think if I could just add to what at the end of, I know my colleague, Patty Hyde, to provincial and territorial health ministers about the importance of having access to the appropriate common platform so this very complex data can be tracked and used appropriately in terms of the safety. It was a comment that Premier Fury, who, as you know, is a medical doctor himself, raised in the last call with First Ministers and Prime Minister Trudeau. Dr. Fury said that he believed it was very important that we have access to this common platform across the country so that the safety and efficacy can be tracked. And I know that's something he told me in recent days that he intends to continue to bring up with ministers in a collaborative way to ensure that, as Dr. Tam said, all of that data can be captured in the right way.
World Juniors are going to be, World Junior teams are going to be coming this weekend to Alberta. Sweden and Germany have had members of their team test positive for COVID. They're not taking part in the tournament, obviously. Do you have any concerns about teams being allowed into the tournament when they've had incidences of COVID on their squads?
Thank you very much for the question. I guess I get all the sports questions. Yeah, we've been in active discussions with the officials in Alberta, both public health as well, obviously, with Hockey Canada. The protocols that we've seen from a pure technical public health perspective, I think I've mentioned this earlier, look good with respect to the fact that they're going to be using or intend to use the same bubble concept as was successful for the NHL and also for the NBA with their playoffs last year. Having said that, though, everyone's also well aware that there's a larger context. You could have a tournament in a bubble, but there's also the situation epidemiologically, what's happening both in Canada, the U.S., and as you now have alluded to, in other countries. So that's something we're keeping an eye on. Certainly all of the participating countries and teams are well aware of the the types of protocols and the public health measures that all of the not just the players themselves, but the team members need to be practicing in advance of the tournament. But certainly as we get closer to the time and people are actually planning to travel, that'll be revisited. I think in general, we're very mindful that it is a federal responsibility for our borders. And certainly I think what we've been doing is looking on a case-by-case basis in terms of what kind of events could be, I think, reasonably sort of undertaken or held in Canada in terms of, I guess, high-performance sport in this case. Thank you.
Thank you. We will go back to the phones for another 2 questions, and then we will come back to the room. We have about 15 minutes left, so please keep your questions and answers. Opérateur.
Thank you. Merci. Our next question. La prochaine question, Boris Proulx, Le Devoir. Your line is open. À vous la parole.
Bonjour. Le premier ministre, hier, s'est dit très confiant que Santé Canada autorisera le vaccin de Pfizer cette semaine. Ça a été répété aujourd'hui. J'aimerais savoir qu'est-ce qui vous permet exactement d'affirmer ça et est-ce que Santé Canada attend en fait la décision de la FDA américaine pour donner son feu vert simplement?
Merci pour la question. C'est Dr. Njoo. Ce que je veux vous dire, c'est que le processus réglementaire au Canada, c'est un des meilleurs au monde. Et je pense que les Canadiens peuvent avoir beaucoup de confiance dans notre système réglementaire. Et c'est aussi un important point à souligner que le processus réglementaire au Canada, c'est indépendant. C'est sûr que nos collègues, les experts de Santé Canada, il y a toujours des échanges, des communications entre eux et leurs homologues des autres pays, mais ce n'est pas dépendant des autres pays. C'est quoi les résultats des processus des autres pays pour suivre le processus ici au Canada. Je pense que ce que je comprends, on est dans les dernières des étapes pour réviser, regarder, analyser les données soumises par la compagnie Pfizer et aussi Moderna, les autres à Santé Canada. On entend une décision, comme on dit, prochainement, bientôt, et toutes les indications, je pense que moi, je suis optimiste, que beaucoup de monde sont optimistes, mais c'est quelque chose, on ne peut pas, comme on dit, donner trop de pression parce qu'il faut respecter le processus, l'indépendance le système réglementaire, parce qu'en fin de compte, comme j'avais déjà constaté, c'est important que les Canadiens soient confiants dans le système réglementaire ici au Canada et que n'importe quel vaccin homologué au Canada est sûr et efficace. Merci.
Merci. En suivi, j'aimerais vous amener un petit peu ailleurs et peut-être entendre Mme Tam également là-dessus. Il y a des groupes comme Justice Center for Constitutional Freedoms qui publient des articles selon lesquels les confinements, les lockdowns sont plus mortels que la COVID-19. On voit aussi ce genre de publications sur les réseaux sociaux, sur Twitter, etc. Je voulais savoir comment est-ce que vous qualifiez ça? Est-ce que pour vous, c'est de la désinformation et est-ce qu'il existe bel et bien une surmortalité due à la COVID-19 prouvée par les données?
Merci pour la question. Oui, c'est sûr, Dr. Tam, moi et les autres, on est vraiment conscient du fait qu'avec les réseaux des médias sociaux, on sait que c'est peut-être la première pandémie qui se déroule pendant cet âge, cette phase dans notre histoire avec les réseaux sociaux. Je pense que c'est important aussi de peut-être sensibiliser les Canadiens que c'est très important d'être, comme on dit, peut-être un peu prudent pour quand on reçoit ou peut-être on regarde quelque chose qu'un ami ou quelqu'un d'autre a peut-être partagé. C'est vraiment important de toujours faire, comme on dit, un peu une liste, une check-up pour voir c'est quoi les critères. Il faut toujours aller peut-être sur les sites fiables parce qu'il y a beaucoup de désinformations. Et si on partage avec les amis des désinformations, ça continue la propagation virale des désinformations. Donc, je pense que c'est important aussi avec les médias ici, aussi de continuer à informer les Canadiens d'une façon crédible avec l'information fiable, crédible, et aussi beaucoup de sites aussi sur l'Internet. Notre site ici aussi du gouvernement du Canada, mais aussi des autres, comme des autres pays, aussi l'OMS, le CDC. Donc, je ne sais pas quoi d'autre à dire. Peut-être Dr. Tam a quelque chose à ajouter, mais oui, on va prendre aussi beaucoup des mesures, des efforts aussi pour continuer à informer les Canadiens avec plusieurs moyens pour qu'ils soient confiants avec qu'est-ce qui se passe actuellement. Et maintenant, on passe à l'étape avec peut-être plus bientôt la distribution des vaccins. Et c'est important pour moi. On parle un peu de réticence des vaccins. Moi, je prends le côté optimiste. On veut renforcer la confiance des Canadiens dans les vaccins. Ça, c'est quelque chose d'important et on va voir c'est quoi les prochaines étapes, qu'est-ce qu'on peut faire dans ce domaine-là. Dr. Tam, non.
Just to add that, of course, as the public health system is well aware of some of the negative consequences of some of the public health measures. But at the same time, as this pandemic escalates in Canada and overwhelms public health systems and the healthcare system itself, where hospitals can't cope or ICUs are full, there's a lot of other impacts on health from that perspective. But everyone is cognizant of the fact that people need to be supported to carry out the public health measures. There's mental health support as well as social and economic support that's required. So yes, there are negative consequences. Yes, we need to do as much as possible to support people while they're doing their best to observe public health measures. But if you do not slow this virus down and your healthcare system can't cope, that can lead to a lot of negative consequences, which you can see in many European countries that have just a bit ahead of us. And if you learn from them what's happening in this resurgence, it's pretty clear that we have to do more in many areas of Canada to slow down the epidemic. Thank you.
Oui, c'est Dr. Peut-être seulement ajouter au début, Dr. Tam et moi, avec nos notes d'allocution, on donne toujours les statistiques et vraiment, dans plusieurs régions du pays, on est à risque de déborder nos systèmes de soins de santé publique. Donc, c'est vraiment, comme dit, une crise actuelle. Il faut faire quelque chose maintenant. Merci.
Merci, opérateur.
Our next question, la prochaine question, David Akin, Global News. Your line is open. À vous la parole.
Good afternoon. A question perhaps for both Minister LeBlanc and Dr. Tam. I'll sort of put the context this way. We are now seeing the provinces release their vaccine priority lists. We know it's a provincial authority to do this. Quebec yesterday, Ontario yesterday, last week Alberta, tomorrow BC, later today Saskatchewan. All provinces so far have modified the federal NACI recommendations a little bit. But nobody yet is saying that we ought to base our priority based on occupation. In other words, truck drivers or daycare workers or teachers. It's really all got to do with where you live, in residences, work in a hospital, live in a First Nations community, or how old you are. And I just wondered, as a matter of trying to convince the public that these priority lists are the right ones and the defensible ones, Dr. Tam, you may have just touched on it a bit by saying, keeping the healthcare system going is a pretty top priority. But I'd like to hear perhaps both of you comment on why or why not we shouldn't be grouping people by occupation, or for another example, students, so that students can get a vaccination and get back to class, et cetera, et cetera. That's the only question I have, if both of you could respond to that.
Thank you for the questions, David. I'll take a crack. Dr. Tam I think said from the beginning, and my colleague, Minister of Health, Patty Hajdu, has had a number of very constructive, collaborative conversations with her provincial and territorial counterparts So has Dr. Tam and Dr. Njoo with their counterparts as well. So this has been a long-standing conversation. The National Advisory Council on Immunity and Immunizations is composed of scientific and medical experts who have continually revised their advice as more is known about particular vaccines, about some of the challenges that Major General Fortin spoke about, for example, in handling certain vaccines as compared to others. So this is very much an evolving space. We've said also, as you noted in your question, that ultimately it is provincial jurisdiction to decide on these priority groups. We hope and believe that they will be informed by this reliable scientific and medical advice. At the end of the day, those policies should rest on the advice of healthcare professionals who are in the best position to determine which particular vaccine and in what sequence should be administered to a population. But the important thing for us, too, is that when the process concludes, we will have had more than enough doses to vaccinate every Canadian who wants to be vaccinated. And as Dr. Njoo said, we remain very optimistic and confident that Canadians will see the value in being vaccinated and will have confidence in the outstanding work done by scientists and doctors to develop a safe and effective vaccine that can be widely distributed to everybody, because that's how we're ultimately going to get the immunity that we need as a country.
Yes, this is Theresa Tam. And if you actually read the whole of the NACI recommendations, they don't stop at those initial four key groups. It continues on to initially resident staff, so congregate living, and then healthcare workers, particularly those in direct patient care, seniors starting from the oldest, adults in Indigenous communities where infections can have disproportionate consequences. It continues on to say healthcare workers, they're not included in the initial rollout, resident staff of all other congregate settings, and essential workers. So again, I think as the Minister LeBlanc has said, this is a continuous stream of vaccines coming, and that there is no sort of concrete war between March, the last week of March and the first week of April. We're just trying to put the operational and implementation lens on top of the public health criteria. So why would we want support to have the residents and staff in long-term care or congregate living where there are seniors? For seniors is because, quite simply put, in the first wave, 80% of the deaths we experienced in Canada, unfortunately, tragically, were related to long-term care and congregate living settings. Much of the hospitalizations are related to seniors. Second wave, this is resurgence. We are estimating that still about 70% of the deaths are linked to long-term care. Data is being collected on an ongoing basis, but just to say that they're very disproportionately impacted. And so that's fundamentally why that group is there. And age is a very key risk factor. There are underlying medical conditions, of course, but when you line them all up, it's the age that really stood out as being a key to looking at the rollout, particularly when we don't have enough doses. And healthcare workers, again, expect that even if you start in direct contact, the ones with direct contact with patients, there will be, as vaccines become available, more will be considered. Indigenous communities, extremely important that we, as provinces and territories, roll out their programs, that equity and the engagement in Indigenous communities is very important. You've just seen in this resurgence that is more widespread than geographically, for example, than the initial ones, that many more Indigenous communities are affected, but also urban Indigenous communities as well. So The NACI recommendations are guidelines, and then the provinces are applying those. But as you've seen, as you've reported, that as these plans come out, they are actually going to look, I think, there's going to be quite a lot of coherence across them. So that's what we've been doing with chief medical officers to strive for an evidence-based approach, but also an equity-based approach.
Yeah, Dr. Njoo, just to add a little bit to what Dr. Tam is saying, is that certainly when you look at the NACI recommendations, they look at the best scientific evidence, look at the experience both in Canada and internationally. And I think the overall goal for that committee, but also that when we then take that advice in terms of the Special Advisory Committee, is to reduce morbidity, mortality among Canadians. And then if you take it to another level, how do you do that in the most effective and efficient manner if, let's say, at the beginning especially, you have limited doses? And so looking at those at greatest risk to actually acquire the infection, have disproportionate consequences, and also be at greatest risk to transmit to others. Those are some of the factors that were in play as we came out with, obviously, these priority groups that we're continuing to discuss in terms of then, to Major-General Fortin, how do we operationalize it with our provincial territorial counterparts in terms of actually vaccinating Canadians? Thank you.
Thank you. We will take a final question from the room. Thanks. No, this is going to be our last one for today, sorry. We will be taking more questions at future press conferences this week. Thank you.
On vaccine tracking, what responsibility does each of the provinces and territories have in tracking who has received what vaccines and when they need to get their second dose? And does the federal government have any role in that?
Yes, the province territories are responsible for the immunization programs, including the tracking of who received what. We are providing support in a number of ways in terms of, for example, if you want to collate information at the national level, there are standards in terms of the actual data that gets reported. So setting some of those. And if we're providing, I guess, financial support, if provinces and territories need it to support their information systems, for example. And we're also looking at an information technology and IT platform that can then track the delivery and implementation of the vaccine program across the country as well, which will help support the province and territories as we begin to sort of roll out the information. But the fundamental answer to your question is that the province and territories are responsible for tracking the first and second dose and making sure that people are recalled and receive the right second dose.
Dr. Njoo, Glenn McGregor, CTV News. In the absence of somebody from Health Canada, and I understand you're following the regulatory process and approval process very closely, could you explain exactly where we are today and what steps have to be gone through before we get to the approval decision? Are they waiting for more information? Are they writing a report? Are they going to have a meeting as the US FDA is going to be doing at the end of the week? What exactly is happening between now and approval?
Certainly, you say I can't speak totally on behalf of our regulatory colleagues at Health Canada. As I think everyone's aware, what they're doing in this expedited process is, they're not cutting corners, but certainly more people have been brought to bear in terms of the file. What also they're doing this time is what we call a rolling submission. So as the data becomes available from the company, they are submitting it to our Health Canada colleagues, and they're looking at it. My understanding is that they're in the final phases of sort of getting those last bits of data that are important in terms of their overall decision-making process. And we certainly expect that a decision is forthcoming shortly. I'm not sure, Dr. Tam, do you have anything else to add to that?
You're still acquiring data? They don't have all the data yet?
This was as of a few days ago, right? It's still, I think, Dr. Sharma, I think, has also indicated that, yes, they were still in the process of getting some other bits of data. And I can't speak to that. Maybe I'm not characterizing it right. But yes, they want to make sure that they certainly have as complete a dossier in terms of all of the data information that they require to do, obviously, the most complete and comprehensive job in terms of looking at it for a regulatory decision.
Thank you, everyone. This puts an end to our press conference. Merci à tous. Ceci met fin à notre conférence de presse